Even though I was an OBGYN, I wasn't really sure where to start besides just stopping birth control. So the first thing that I think is important to think about if you want to get pregnant is going to be, when should you stop your birth control if you're coming off of birth control? But all studies show that using at least one method of fertility awareness helps you get pregnant faster. No one method is superior to the other, but using two is even the best. So I think if you're really first starting to try to track and try to get pregnant, targeting your fertile window can be helpful to know that you are in fact ovulating, to know that you are having intercourse in the right time frame, and to help you get pregnant faster. If you're having irregular cycles, that warrants an evaluation immediately. We need to get to the root cause of what is going on, and I don't need you just trying if I already know something might be preventing you from getting pregnant. Welcome back to the As a Woman podcast. I'm your host, Dr. Natalie Crawford, and today we are talking all about what to do before you want to get pregnant. So I know that when it was my own time and I was ready to conceive, even though I was an OBGYN, I wasn't really sure where to start besides just stopping birth control. So today I'm going to go over some of the basics about when you should stop birth control and different types of birth control, what you should know about your cycle and how to track your cycle, and some of my top tips and things to look out for if you are starting to get pregnant or you're thinking about that in the near future. So the first thing that I think is important to think about if you want to get pregnant is going to be, when should you stop your birth control if you're coming off of birth control? And of course, birth control is a really broad topic, and it's important to think about how these different forms of birth control all work. So classically, we're going to talk about the birth control pill when most people talk about birth control, but we're also going to dive in some other forms of hormonal contraception like the IUD and the shot, because they work in a different way. But anytime I want to talk about birth control, I've got to start by talking about how ovulation occurs, because understanding ovulation is the key to understanding when to get pregnant, but also how that different type of birth control, how it all works. So the best way to think about this is every single month you have a whole group of eggs available to you, and each egg grows inside that small fluid-filled structure called the follicle. Well, the brain's going to send out FSH, or follicle stimulating hormone, which is going to stimulate a follicle to grow. And as that follicle grows, the egg is maturing and it's making estrogen. Well, estrogen is that hormone that's rising, making you feel good, increasing your libido and your concentration. But when estrogen gets to those peak levels, it's going to tell the brain that it's time to ovulate. And the brain's going to send out a surge of LH, or luteinizing hormone. LH allows that follicle to ovulate, meaning it's going to rupture, the egg is going to come out, and the follicle is going to reform. Really importantly for conception is that the egg can only live for 24 hours. And so it must be fertilized in that time frame. But that doesn't mean that your fertile window is just one day. It's actually a little bit longer. And that is because the sperm can live inside the female reproductive tract for up to 5 days. Well, after you ovulate, that cyst is going to form called the corpus luteum, which is the follicle that the egg grew in, now becomes a progesterone producing factory. And it's going to make progesterone in pulses stimulated from LH from the brain throughout the entire luteal phase. And progesterone opens and closes the implantation window. In fact, when we do IVF, we put the embryo inside after a very specific amount of progesterone, too much or too little, and the transfer will not work. That is why understanding when progesterone is rising is really, really key to understanding when you can get pregnant and when an embryo can implant. Well, after you don't get pregnant, if you don't get pregnant that month, then what's going to happen is the corpus luteum is going to die, your progesterone levels are going to drop, and you're going to have a period. If you do get pregnant, the pregnancy actually comes in and starts to implant inside our uterus, and it makes a hormone called HCG, or human chorionic gonadotropin. Now, HCG actually binds to the same receptors as LH. Isn't that crazy? So it's going to bind to these same receptors, and what does it do? It stimulates progesterone production, but in a very different way, because LH came in pulses, so progesterone was made in pulses. But HCG is now binding, and as the pregnancy grows and develops, HCG is going to be released at an increasing time frame. So you're going to now see a constant and increasing exposure to the hormone telling you, let's make progesterone. So similarly, progesterone levels are going to rise and be more constantly produced, causing most of those pregnancy symptoms that we come to associate with an early pregnancy. These are all due to high progesterone. Things like nausea, sore breast or breast growth, fatigue, really low energy. It's all because of progesterone, that progestational hormone, trying to slow your body down, eat more food, have enough calorie and energy reserves to grow a new human being. But understanding that ovulation cycle is really key when we start thinking about how birth control works. So if we start with the birth control pill, this is actually a combined pill of a type of estrogen called ethinyl estradiol and a type of progestin. Now, what this does is these hormones talk to the brain, and the brain thinks that you are already ovulating because it sees this estrogen level. So it does not send out FSH, so you do not grow a follicle or ovulate, which makes it a very effective form of contraception. However, the progesterone is also on board, so you can't get pregnant because it's changing the integrity of the uterine lining. When you're taking a birth control pill, what you'll notice is that you don't have a bleed unless you stop the pills or you go into the placebo pills. That is because the trigger to have a period is that drop in progesterone levels. Well, the birth control pill is actually very, very short acting, meaning even if you just miss one pill, you might ovulate or get a period. And so we want you to take backup pills and really change the integrity of that lining so that implantation cannot occur if you do happen to miss a pill and you're trying to prevent a pregnancy. But this means that there's no reason to feel like you have to cleanse or give yourself a prolonged period of time of stopping the birth control pill before you want to get pregnant. In fact, most women will start ovulating immediately after stopping the birth control pill, even if they took it for a prolonged period of time, and you could detect ovulation and conceive the month after you have started. One of the issues though, especially right now, I don't know about you, but I was on the birth control pill for a very long time when I was not ready to get pregnant. It was a really reliable form of contraception for me. But that meant I had no idea what was happening in my real cycle. I could not use that as a vital sign to give me any good information about my body. And so I usually recommend that you stop the birth control pill about 3 months before you want to get pregnant. And the reason why is this way you can learn to track your cycle and you can see when is your period coming. You can decide what you need to do about this. And if there's an abnormality, now you can go and you can get an investigation done before you've already started trying for months and not had success, which I know can be really, really frustrating. So for the birth control pill, it doesn't need to be cleansed out. You don't have to buy anything expensive to get rid of it. You can get pregnant immediately upon stopping, but my recommendation is to stop it 3 months before you want to get pregnant. Now, a hormonal IUD is typically a progesterone IUD, and the hormonal IUD is really great because it can go in your uterus and it secretes progesterone over a prolonged period of time. Depending on the IUD, this might last up to 7 years, which means you don't have to think about it and it's extremely effective. As we talked about, based on the function of progesterone, you now know that progesterone is making it so you can't get pregnant because it's changing the uterine lining. But in IUDs, it's not always changing ovulation. It may not actually be preventing ovulation at all, or sometimes it does at the beginning because progesterone levels are higher, but after years of use, you might actually notice lower progesterone levels and you might start ovulating again. So what we see with the IUD as one of the biggest issues is that if you have no periods on an IUD, which is a great side effect if you don't want to be pregnant, is that the progesterone has thinned out the endometrial lining so much that it actually can make it hard to get pregnant when you want to, because it can take some time for that lining to grow and to build back up. Due to this, if you have an IUD, I recommend that you get it removed 6 months before you want to get pregnant. That way you can start to see your lining build up again. Now, if you still have regular periods on your IUD, you don't necessarily have to do that. If they're very, very light, but you are bleeding, I would still recommend taking it out a few months ahead of time to give your body some months without constant progesterone exposure. But if you have amenorrhea, which means no bleeding on a progesterone IUD, I recommend 6 months out, you remove it so that you can start to give your body time to grow back up a lining and then see if you have an ovulatory pattern. Occasionally, I actually have to give a patient estrogen for a while to really help saturate all those estrogen receptors in the uterus and help their lining grow and develop again. And we don't know if that's going to be you until we give your body a little time. Again, though, some people get pregnant immediately upon the IUD being removed, and so it's not birth control still, but we want to be able to see how your cycle is functioning. A copper IUD works totally differently. There's no hormones. It is just impacting the inside of the uterus by inflammation. And so it is toxic to sperm and makes it so you can't get pregnant. But you can remove a copper IUD immediately. It's not impacting your ovulation at all, and you can get pregnant in that next cycle. And there's one form of contraception I do want you to be aware of, and that is going to be the Depo-Provera shot. This is considered the injectable shot for birth control, and it is a shot of very high dose progesterone that you get every 3 months. Well, the thing about this is that it's proven in studies to prevent ovulation for 3 months, but did you know that it might prevent ovulation for up to 18 months? Yes, that means one shot of Depo-Provera right now might prevent you from getting pregnant for a year and a half. So if you want to get pregnant anytime in the next 2 years, this is definitely a birth control option I want you to switch away from and use something different. So let's say you've stopped your birth control and hopefully your period came back. If you didn't have a regular predictable period, you need to go get an evaluation. So if it's been 3 months off the birth control pill and you don't have a regular cycle back, 6 months off of a hormonal IUD and you don't have a cycle back, these are warning signs. Your body is telling you that something is not right. It is no longer just due to that contraception anymore, and it's time to go get a bigger evaluation. Well, let's say that your period does come back normally. Well, what do we need to do to get pregnant? Let's talk about tracking your cycles in the fertile window. As I said earlier, ovulation occurs and the egg can only live for 24 hours. It must be fertilized in that time period. But sperm can live in the female reproductive tract for up to 5 days. And so that means the fertile window in your cycle is the 5 days before and then the day of ovulation. So typically we say this is the 6-day window ending on the day of ovulation. And if I was going to have my way, this is when you should target intercourse if you're trying to conceive. One thing I want you to think about is that very frequently people will say, well, we shouldn't have sex every day, or, oh, we should have sex less or every other day. But the reality is a lot of this comes from studies looking at couples who weren't used to having frequent coital practices. So what is the recommendation? Well, if you were only going to have intercourse one day and you want to get pregnant, it would be the day of ovulation. If you were going to have intercourse 2 days, it would be the day before and the day of ovulation. Because people get burnt out on having sex, if this isn't a common occurrence for them, we ask them to have sex every other day because then you don't have to worry about the exact day that you are ovulating. We know that you're getting sperm there. And because sperm can live in the female reproductive tract for up to 5 days, most of it is going to be around for a good 48 hours. Every other day is more than sufficient. And one thing I've seen in my patients is if they don't have frequent intercourse and then they start trying to have intercourse at the start of the fertile window, they may get burnt out and not be having sex when it really matters the most. But if you are in a relationship and you currently have intercourse every day, do not have less sex when you try to get pregnant. Your current practice is just fine. Keep up your routine, and it even becomes less important to track exactly when ovulation occurs to target intercourse. But that doesn't mean that tracking when ovulation occurs isn't important for just getting pregnant, but for understanding your body, because understanding your body and your cycle is very, very important. A couple other top intercourse questions is that there's no lube that you need to use that's going to increase your fertility. In fact, no lube is going to be the best, but if sex is painful or you need lubrication, make sure that you're choosing a fertility-friendly lubricant. And if we're thinking about positioning, you don't have to lay on your back, put your legs in the air, hold your pee. You actually can get up, go to the restroom right away. You don't need to trap the sperm inside. Remember that sperm are very fast. They swim out of the ejaculate very, very quickly. The vagina is acidic, and the semen sample, the ejaculate, is actually alkaline, and that is so that it can protect the sperm. The sperm quickly swim out of the ejaculate into the cervix, and it's the cervix and the upper reproductive tract where they actually hang out. If you get up and go to the bathroom right after you have intercourse, you're not seeing a bunch of sperm fall out of your vagina. What's actually coming out is just the seminal fluid and the ejaculate itself that was the protective barrier helping to keep the sperm safe in the vagina. You don't need to hold your pee or risk getting a urinary tract infection. You are free to get up and live your life. The sperm are on their way and they are on the hunt for an egg. My tips for cycle tracking, there's about 1 million different ways that you can track your cycle right now. And a big word to the wise is there's a lot of different apps out right now. And it's really important to know that studies have shown that some of these apps can falsely tell you when your fertile window is. And this is because they are just using a calculated based method and they are using maybe data that's not personalized to you. I've actually used some of these apps myself, and some of them give me a completely false fertile window. And yes, I have the added advantage of being a fertility doctor, so I can go to my clinic and do an ultrasound and check hormones really easily to get to the truth of the matter, because I couldn't believe how inaccurate some of these apps were. This is why if you're going to track with an app, because I know that it's easy to just pull out your phone, I also want you to track with another fertility awareness method. These are physical signs that your body is telling you. This is because the apps are all based on something called the simple calendar method. So the simple calendar method is based on the premise that the luteal phase should be 14 days in length. So it's taking your total cycle length and subtracting 14 and saying that that is the day of ovulation, based on no actual facts besides a formula. So if your cycles are every 30 days apart, it's going to say 30 minus 14. It will tell you that you ovulate on day 16 and that your fertile window is going to be the 5 days before that and then on cycle day 16 itself. Well, if your luteal phase is short or if your luteal phase is long, your app is not taking that into account. So by pairing that calendar method, which the apps use, with something that your body is telling you, this can be a great way to learn if that app is accurate for you and to know when you are ovulating so you can evaluate your cycle health in general. My favorite ways are going to be with cervical mucus monitoring or with basal body temperature. Cervical mucus monitoring is one of my easiest ways possible. This is going to be an evaluation of the cervical mucus. The cervical mucus changes in response to estrogen. So as an egg grows, it makes more estrogen, and the estrogen changes the consistency of the mucus at the cervix. And the cervix is the entry point to the uterus. What this means is that as you get to peak estrogen levels, your cervical mucus becomes very stretchy, sticky, and it's egg white. So you don't have to put your fingers inside or do anything uncomfortable to evaluate your cervical mucus. You actually can evaluate it right at your introitus, which is the opening to the vagina. So when you go to the bathroom, before you urinate, I want you to take toilet paper and just wipe and notice if there were any vaginal secretions that you see. Type 4 cervical mucus is going to be that sticky, egg white, stretchy, that if you pick it up and you put it on your fingers, you'll notice that it stretches and it pulls apart. And what we want you to do is really target intercourse at that type 4 cervical mucus. That happens on your ovulation day. So if your app is telling you that it's ovulation day and you're also seeing this with your cervical mucus, fantastic. Another way is with basal body temperature, BBT. Basal body temperature is based on the premise that when your body makes progesterone after ovulation, your core body temperature rises. This is why women are always cold, because their core body temperature wants to be a little bit warmer. But after progesterone is made, you can detect this shift if you know what your baseline temperature is. I used to have women come in to see me and they would have these really complicated temperature charts where they were tracking their basal body temperature every single day. But honestly, this has gotten a lot easier with modern technology with some wearables. There are now digital thermometers, Oura Rings, Apple Watches that can integrate with technology that can allow you to monitor your temperature while you're sleeping or in the early morning hours. Importantly though, your basal body temperature will change in response to drinking alcohol, to not getting enough sleep, to being sick. So it's not a perfect method. And it's only telling you after you've ovulated. So it's not a predictive method, meaning it is confirming that ovulation did in fact occur. Your temperature rises about 3 days after ovulation occurred. But it can be a great way to say, well, if the app said my ovulation occurred here, or this is the day I saw cervical mucus, and my BBT rose here, that will confirm that it did in fact happen. Basal body temperature tracking is a really great way to get into knowing your hormones better. But again, by the time your temperature has risen, it's too late to have intercourse to get pregnant. So you need to be having intercourse ahead of time. And then we've got ovulation predictor kits, which are urinary-based kits detecting LH. So much like a pregnancy test where you would urinate, this kit is telling us if LH is being released. And LH is first released in response to those high estrogen levels from the mature egg. So if you can detect that first LH release or that LH surge, you can now have a predictive moment where ovulation is going to occur that next day. So if you're using an ovulation predictor kit, here are some of my tips. Despite what the box says, I recommend that you urinate on the strip 1 time per day between 10 a.m. to 2 p.m. That is because LH is released from the brain in the early morning hours, and we have to give it time to get processed through your kidneys and get into your urine. And once you see a positive, that's it. You need to have sex that day and the next day. That would be my recommendation. But you do not need to keep taking more OPKs. You are just wasting your money. Save them for the next month. I really like OPKs because they're more predictive. They're giving you an actionable item about have intercourse right here. It can be a little more expensive to buy OPKs month after month. And if you're noticing that you're always having the same fertile signs, so if your cervical mucus and your OPK are corresponding, you might be able to just do cervical mucus monitoring in the future and have that be very accurate because that is a free method as opposed to something that you have to pay for. But all studies show that using at least one method of fertility awareness helps you get pregnant faster. No one method is superior to the other, but using two is even the best. So I think if you're really first starting to try to track and try to get pregnant, targeting your fertile window can be helpful to know that you are in fact ovulating, to know that you are having intercourse in the right time frame, and to help you get pregnant faster. But it also gives you some keys to your cycle so that if things are not normal, you're able to jump in and intervene faster. So when it comes time to get pregnant, there's a few things that I want you to know. Number one, your age matters, but it's not everything. Your eggs have been inside your body your entire life. Unfortunately, this means that they have absorbed some of the wear and tear of everything that you've been exposed to. And we know that chromosome damage increases the older that we are. This causes us to have lower success rates with each month that we try to get pregnant. It takes us longer to get pregnant, and we have higher rates of miscarriage and pregnancy loss because of it. But that doesn't mean that pregnancy or conception is impossible, but it means that you might need a different game plan. Unfortunately, there's no test to tell us about your egg quality, so we have to use age and other markers as far as your lifestyle and your overall health as the best factors to guide us on this. If you are under age 35 and you're trying to get pregnant, you should get pregnant within 1 year of trying. And if you have not, you should see a fertility doctor to get an evaluation. However, more than 70% of people will get pregnant in those first 6 months. So it's very reasonable to see a doctor sooner than that if you are concerned that something might be going on. If you are 35 to 40, the recommendation is that if you're not pregnant after 6 months of trying, that you should schedule a consultation for a fertility evaluation. And if you're 40 or older, I recommend you come see a fertility doctor right away and get initial testing done. Initial fertility testing is not scary. What we're doing is we're checking your uterus, your fallopian tubes, your ovaries, your egg count, some basic hormones, and a semen analysis because sperm are a part of the picture. We're just trying to get data so that you can make decisions on data that you know instead of data that you don't know. And so a fertility evaluation is pretty straightforward. It takes about 1 month, and then you can sit down with your doctor and make decisions. Sometimes if you are older, it makes a lot of sense to change your game plan. Maybe you need to be more aggressive. Maybe you want to start fertility treatment sooner. But what you don't want to do is spend more time trying if it was never going to happen. If there was something that was going to prevent pregnancy from occurring, such as if your fallopian tubes were blocked or if your partner's sperm count was 0, your time is very important. In fact, I would say it's your most valuable commodity that you have. So on your journey to try to get pregnant, if you're older, at the very least, get a fertility evaluation sooner so that we can know that all of the parts are in working order or intervene sooner. Number 2, I want you to track your cycle. I already talked about how, but if you're wanting to get pregnant, besides just paying attention to your age, I want you to track your cycle. You can choose any of the options that I went over, but your period should be regular and predictable. And if it is not, or you're noticing any abnormalities, a short luteal phase, a lot of spotting, a really long follicular phase, irregular cycles, do not pass go. You should see a fertility doctor immediately. You don't need to try for 6 months or 1 year. If you're having irregular cycles, that warrants an evaluation immediately. We need to get to the root cause of what is going on, and I don't need you just trying if I already know something might be preventing you from getting pregnant. So please don't wait any set amount of time if your period is irregular or abnormal, and tracking your cycle can be extremely advantageous. Number 3 is going to be to start taking a prenatal vitamin. In the perfect world, you would take a prenatal vitamin for at least 3 months before you want to get pregnant. And I wish that we could just get every single nutrient that your baby needs from foods and the diet that you eat. But the truth is, a lot of these nutrients are so very important that it's not worth the risk of not taking a prenatal vitamin. One word to the wise is that a lot of designer or fancy prenatals actually include something called methylfolate. Methylfolate is a downstream metabolite of folic acid. Folic acid is an important B vitamin, and it's really essential for cell division. And in a baby, it's important for formation of the brain and the spinal cord. If you don't have enough folic acid, you can have a birth defect called a neural tube defect. And this could lead to no brain formation or an open spinal cord, and it can be devastating. And I don't want that to happen to you. And the best way to prevent this is by taking a prenatal with at least 400 micrograms of folic acid every single day. Well, methylated folate as a downstream metabolite has gotten a lot of attention lately because people say it's easier to absorb and so it's going to be better. And one thing that I always say is what might be better for you in your day-to-day life may not be what is best for you when you're pregnant, trying to get pregnant, or for your baby. And the only studies that have shown a prevention of neural tube defects is with folic acid itself and not methylated folate. And even though based on its mechanism or based on other blood levels, methylated folate should be fine is not good enough for me when it comes to my baby's brain development. So if you are taking a prenatal vitamin that has methylated folate in it, but you like it, it's easy on your stomach, it's easy for you to take, it's the one that you will remember to take, I recommend that you also buy a separate folic acid pill. Don't take an additional prenatal, but take a specific just folic acid pill in addition so that you can have that folic acid on board to prevent a neural tube defect. It is not going to be harmful to take folic acid and to take methylated folate. It's a B vitamin. You will just pee it out if it's too much. But know that methylated folate, despite a lot of the popularity on social media, is not better when it comes to a developing baby. And I want what's best for you and what's best for your baby. Number 4 is going to be to consider doing a preconception consult. Did you know that your OBGYN has a specific type of appointment called a preconception visit? And this is probably their very favorite visit that they do. In this visit that you see them, they're gonna draw some blood that's important, things that you might wanna modify before you get pregnant, talk about any other medical problems you might have, do you need to switch any medications to be pregnancy safe, and make sure that everything is good to go to get pregnant. This is a great time to ask some of your questions about what the pregnancy will be like, when you'll see them, and what your clinic's policies are when it comes to delivery and prenatal care. All right, and number 5 is going to be to pay attention to your lifestyle. When it comes to your overall health, we know what's healthy and what's not healthy, but you might not realize that these same principles play a huge role on your fertility. And this is because your egg health, your sperm health, and your environment all impact the ability for an embryo to form and to implant. And so these basic principles include really trying to lower inflammation from your world. So the foods that you eat play a huge role. If I could have my way, you'd eat a lot of whole foods, fruits and vegetables that are highly nutritious for you, and you would limit foods with added and artificial sugar, refined carbohydrates, processed foods, takeout foods. Foods that are really healthy and fat are essential. You may not know that cholesterol is the backbone of some of these hormones like progesterone. And so you need to be focusing on some of those healthy fat intakes. Things like avocados and olive oil, your nuts, those are great sources of fat. You do not need to live in a low-fat world or avoid fats altogether. I also want you to think about the rest of your world. So are you getting enough sleep, at least 7 to 8 hours a night? Are you building muscle with your exercise? You don't have to go crazy. We really want to shift our focus from high intensity interval training cardio to making sure that we are building muscle. That muscle mass can help fight insulin resistance, which helps you be in your hormonal best, but also prepares you for pregnancy itself because your body has so many changes when it comes to pregnancy. And it's important to mitigate your own stress however you can. So whether that's yoga or journaling or acupuncture, meditation, do something just for you. Let that cortisol level drop and put yourself in the right mindset to convince your body that this is a good time to be pregnant. And do not forget sperm health. The same rules apply of what's good for eggs is good for sperm. But in addition, because the testes are outside the body, the sperm are supposed to be made at a lower body temperature. We don't want anything that's going to increase our body temperature. This is why things like saunas, hot tubs, even laptop in the lap are big no-nos when it comes to sperm production. So make sure that you're equally paying attention. In fact, toxic behaviors in general should be stopped, but things like alcohol, cigarette smoking, and marijuana can actually have a huge impact on sperm and fertility overall. So please get your partner involved and make these healthy changes for both of you. All right, well, I hope you enjoyed learning some about my top tips if you're wanting to get pregnant and things that you should focus on before it's time to start trying to conceive. I appreciate you here so much on the As a Woman podcast and can't wait to see you next week. Thanks, friends. Thank you for listening to the As a Woman podcast. Please consider subscribing, sharing, and leaving a review so that other women can find their formula for health. For more on fertility, hormones, and reproductive health, follow me at Natalie Crawford MD or visit nataliecrawfordmd.com because knowledge is power and your health deserves a formula made just for you as a woman.